Greetings. Today I'm going to talk about what bioidentical hormone replacement therapy is. Hormones play a vital role in regulating many functions in the human body, including metabolism, mood, growth, and reproductive health. As people age or experience certain health conditions, hormone levels can be thrown out of balance, leading to symptoms such as fatigue, hot flashes, mood swings, memory issues, or decreased bone density. As we age, all but one hormone tends to decline. The exception is cortisol, the stress hormone. To address these imbalances, healthcare providers may recommend hormone replacement therapies, HRT. One approach that has gained attention in recent years is bioidentical hormone replacement therapy, BHRT. Note that there's a big difference between synthetic and bioidentical hormones. Some of the early studies were done using the wrong hormones, progestins instead of progesterone, and Premarin instead of estradiol. Premarin is derived from pregnant mares' female horses' urine and contains estrogens that are different from what a woman's body makes. This led to many doctors believing that hormone replacement was not good, which was dead wrong. The wrong hormone replacement therapy is bad. Bioidentical is good. If we haven't met already, I'm the digital avatar of Dr. Max McLeod, aka the Nutrition Ninja Doc, founder of MyBodySymphony.com and ARTC.Health. While he continues to research and explore new and better ways to help his patients achieve their health, performance, and appearance goals, I'm here to convey his knowledge and insights about health, healing, and regeneration. Doc Max believes in using technology constructively to improve efficiency and results. That's why he uses this AI-generated avatar to educate and inform. Before we get into it, please leave a like on this video if you find it helpful, and if you haven't already done so, please hit that subscribe button because it goes a long way toward helping spread these health-related presentations to more people. Understanding BHRT, bioidentical hormones are compounds designed to have the same molecular structure as the hormones naturally produced in the human body. Because of this similarity, the body is thought to recognize and use them in the same way as its own hormones. The most commonly prescribed bioidentical hormones include estrogen, progesterone, and testosterone. These hormones can be made from plant-based sources, such as soy or wild yams, and are then processed in laboratories to achieve a structure identical to human hormones. So even though they are synthesized in the lab, they are identical to the body's naturally produced hormones. They are available in various forms, including creams, gels, pills, injections, pellets, and patches. Some are approved by regulatory authorities, while others are compounded in pharmacies according to individual patient needs. Why people consider BHRT. Individuals often explore BHRT for relief from symptoms associated with menopause, perimenopause, and andropause, age-related hormone decline in men. Some reported benefits include reduction in hot flashes and night sweats, improved sleep and mood balance, support for bone health, increased energy and focus, enhanced libido and sexual function. Because BHRT can be tailored to the specific hormone levels of a patient, some people view it as a more personalized option compared to traditional synthetic hormone therapies. Safety and considerations. While BHRT may offer benefits, it can potentially have some risks, although they have yet to be identified. Hormone therapy of any kind can influence cardiovascular health, blood clotting, and certain cancers, depending on individual medical history. In studies to date, the effects are all positive, but the long-term safety of compounded bioidentical hormones is still being researched, and regulatory oversight may vary depending on the type of prescription. For this reason, it is essential to undergo a comprehensive medical evaluation, lab testing, and ongoing monitoring when considering BHRT. Decisions should always be made in consultation with a qualified healthcare provider who can assess both the potential benefits and risks. Conclusion. Bioidentical hormone replacement therapy is an option for managing hormone imbalances and related symptoms, particularly during midlife transitions. Its appeal lies in using hormones structurally identical to those naturally produced by the body. However, like all medical treatments, BHRT should be approached thoughtfully with professional guidance and individualized care. As always, please reach out for information on our personalized health enhancement and age reversal programs, including bioidentical hormone replacement and peptides, 941-806-45511.